World Mental Health Day. This year's focus is on young people and mental health in a changing world. And here to tell us about the incredible work they do across Leicestershire and Rutland with their free support to help anyone in our area is the Deputy Boss, Andrew Bolland, and someone who's been suffered with mental health issues who now works for LAMP. It's Mark Jackson. Afternoon, both.
Hiya, Jimmy.
Hello. Okay? Thanks for coming in. Now you've had a bit of an emerging morning, haven't you? Something that happened. Tell us about that.
Indeed, not relative to mental health per se, but yeah, travelling into work this morning. Stopped at a petrol station to come across a gentleman who collapsed next to me with a condition. I don't know what that condition was, but required a 999 intervention. A very physical presence of an illness or a disability. Put into perspective to me about how life can change in an instant with a trauma. In that case, a physical trauma. The work that we do at LAMP is around those people who have some of those invisible issues going in their life that in any other circumstance, physical, you talk to a doctor, you'd ring an ambulance. What do you do for a person where they're suffering poor mental health, where there is stigma, people don't talk about it, hide those issues, and don't see it as something that can be treated?
And today's all about highlighting that, isn't it?
Absolutely about that we shouldn't have stigma around mental health. It should be something that we are comfortable talking about, we're comfortable engaging with the subject. The issue is how we support people through that, and it isn't always about a medical intervention, it's about a social intervention that helps people and empowers people to go on that journey of recovery, if I can call that, from a poor mental health position to one where they can take a full part in society and help other people in society as well, which is a model that we use at LAMP to move people from being service users to being actually service deliverers, where they can generate benefit from themselves and to other people by helping other people on that same journey.
And Mark's one of those people. Now, we'll get to your story in a minute, Mark. I just want to ask you about LAMP, for anyone who doesn't know, because it's been going nearly 30 years. So how did it start and how did you get involved with it?
Okay, yeah, LAMP has existed for nearly 30 years now. It's our 30th anniversary next year. We've come from that perspective of providing advocacy support to people throughout that life, throughout that journey, about empowering people so that their voice can be heard when they are trying to access services, be that health service provision or other services, so that people understand what those people need, what they want, and that actions aren't imposed on them, that people are participative in the actions that they are engaging with to help them on that recovery. And that's what we've been doing for 30 years. Some of those actions, some of those interventions are intensive. That can be people in patient units on wards. It can be one of our big themes for next year for our 30th anniversary is 30 acts of kindness. It can be literally the person that says, "Are you okay?" in the morning, and asks again, "Are you sure you're okay?" Says hello to somebody when they're perhaps feeling low and shows that compassion to a person that perhaps moves on that journey that, actually, I feel really low now, but somebody cares for me. Somebody's done something positive that makes me feel a little bit better, that enables me to start that journey of recovery onwards.
Do you think we're worse at that now? Do you think the things like social media has stopped us from picking up the phone and chatting to a friend as we probably would because now we're all too busy?
We can look at the stats around the use of social media and that impacts on mental health. I think we have to accept it's a reality within society.
But if we're focusing on young people, which this is this year,
it is indeed.
Social media is a huge part of that, isn't it?
It is, and it's absolutely managed. It would be unrealistic, I think, to say that, we tell people not to use those systems because that is part of everyday life. It's using them in a way that is effective, that's appropriate, and ensuring that the support structures around people, that when some of those issues occur that cause people to perhaps have anxiety, depression, body image problems, that they actually have a support network that they can turn to, which, amongst other things, is what LAMP provides and others, that can help them to rationalise what this social media world is and some of the reactions they have to what they're seeing, what they're reading, how they're being talked to, can be supported through. It's not about the person, it's about how that interaction of the world around them is affecting them and trying to support people through that.
Now, in The Guardian today, as I was on the train reading various different papers, there was a headline that said 800,000 people kill themselves every year. Now, we know that's 4,500 here in England and Wales. Still too many. One is more than enough, and it says that was more than the population of Washington, DC, Oslo or Cape Town. So what can we do? What do you think?
It's actually going back, as I said, to that 30 acts of kindness that we're talking about this year and onwards. Treating people with respect and dignity, listening to people, watching how they're interacting in a workplace, for example. We're going to go to one of the big employers within Leicester shortly. and interacting with employees, making sure they feel supported, that they're able to talk about some of the pressures of life. I'm sadly over 50 now. I say sadly, that's who I am. I worked in an environment where we didn't talk about, I'm feeling down today. We didn't talk about some of the issues that affect a person's well-being. And that perhaps is the scenario that leads to people taking their lives because they've nobody to talk to. Talk to your colleagues when they come in and they're looking a bit down. Try and have the conversation that shows support. If there's something that you want to talk about, if there's something I can do to help, and I say that doesn't have to be a big thing. That could just be the little things that just says I'm there. That might be the difference that turns that 4,500 into 4,499, and that's important. Obviously for the person, it's important for the family. It's financially important because every one of those suicides, if I turn it into financial context, costs the system, and I hate to talk about system, but it does, £1.7 million. That's £1.7 million that could be invested in other services that would actually help people upstream before they get to the position where, sadly, the person takes their life because of their circumstances. But yeah, absolutely, everyone shouldn't happen. Support networks like LAMP help to do that by providing people with a voice, a hearing ear. But everybody should be doing it every day, just making a little difference to people's lives that makes them feel valued, that makes them feel there is somebody I can talk to when I hit some of those dark times that might make a choice, which, to me at least, is never the right choice.
So maybe one thing today could be look on your phone book at someone you've not spoken to for ages and just give them a ring.
Give them a call, talk to them, ask them how they are. Say hello to the neighbours as we perhaps used to do 30, 40 years ago. Say, how are you doing?
Why don't we do that now?
Why? I think society's changed. I think we've got a nuclear society. People are much more mobile. We can link into it, rented property where people don't generate connections in the local communities. As you can tell from the accent, I grew up in West Yorkshire. I'm now living in Leicester, so I don't see my dad as much as I do, so I don't see friends and family. But you're absolutely right, Jimmy. Does that stop me ringing up the person and just asking, how are you doing today? What's been happening? Is there anything I need to know about? And that will make a difference to a person that might just put them on a slightly different journey that doesn't lead to some of those sad statistics that you've talked about.
I don't mind admitting this, but I had a conversation with my dad the other day, and I was on the way home, and I'll often phone either my mum or my dad. I'm hands-free in the car, and that's where I do most of my calls because it's the point where I've got some free time. So I phoned my dad and I said that I was thinking about things, and I said, normally when I get to see you is by a byproduct of either see you doing something with my younger brother or my sister who's over from Australia, because she's been over for a couple of weeks. And I said, it's always a byproduct. There's never time that we've actually put in together that's actually concentrated on my little two girls. And I said, look, I'm not being funny. This isn't me having a go. I was just thinking about it, and I would hate 10 years to happen, or maybe something happened to one of us or whatever, and we've not had that conversation.
Indeed.
I said, so we're having the conversation.
Indeed, and having that thought process about how you can just do something that will make a difference to somebody else. And if you do that, it's the best thing that everybody can do every day. And I can absolutely tell you, Mark will concur as we move on to Mark, perhaps, the difference that we make from it. I was talking to a lady today. We had a meeting as part of Mental Health Awareness Day, inviting people in for a tea and a cuppa.
How did it go?
It went absolutely brilliant. A number of our service users turned up. A lady called Lily, and I asked her, am I okay to use a voice today? And as she walked out of the day of the office, she turned to me and asked her, are you okay if I mention you on today? And she said, yes, because I don't mind saying I've accessed LAMP as a service user, and it's made a real difference to my life. I've been an accountant in a past life. I've been an engineer. I've been a business manager. And there's nothing that gives me more pride and passion than to hear somebody just say, you've made a difference to my life. Because that matters far more than counting numbers, to counting bits that you churn out of a sausage machine. The thing that makes a difference is when actually the person turns and says, actually, you helped me. And if we can all help somebody, we'll get somewhere.
Now, Mark, I want to talk to you, but I want to play a record. Right, I'm with Andrew Bolland and Mark Jackson from LAMP. What is LAMP? What does it stand for?
It stands for Leicestershire Action for Mental Health Project, hence we shorten it, so it's something that is perhaps more appropriate and more people can link into more. But it says what we do because we provide services across Leicestershire and Rutland.
It should say shining a light on mental health. LAMP.
That would be really good, and those themes are really good because in this modern world we need to capture the images that link to people.
Right, Mark, let's get to you. So what's your story? When did you discover that you had a mental health issue?
Well, I've had sort of ongoing mental health issues since just before university, but I, similarly to what we were talking about with communication, I just tried to muddle on and deal with it as best I could myself. I didn't really talk about it. I didn't really seek help for it because I saw it as because of how society kind of deemed it, you almost see it as a weakness in yourself, and you don't. I didn't like how people might judge me for how certain things were, but then I had a breakdown about 4 years ago. Ended up with a hospital admission and 3 subsequent admissions after that, which led on to being diagnosed with autistic spectrum disorder, which has been something that had been missed through my education and most of my adult life. And through that, it's kind of given me a lot of closure to things which I hadn't understood when I was younger, and I hadn't understood why I was feeling the way I was feeling, why I was getting depressed, why I was getting anxious. So it's helped a lot, and having the access to services, having access to a community psychiatric nurse, having access to LAMP when I've been in hospital, which was either through the peer advocates who are the volunteers, and also the formal advocates, was instrumental to my recovery, because it helped to be able to talk about things and open up and actually realise, well, hang on, I shouldn't be ashamed of who I am and why I'm feeling this way. It's a part of who I am, and how am I going to move on from it to bring a positive, I suppose, yeah.
And is it a challenge every day for you?
It can be, yeah. I'm still a service user. I still see a consultant up at the Bradgate. I do have very bad days, but I am managing them better now. I'm communicating more. I talk to people. I talk to my wife. I didn't used to. It was just something that I always thought, well, I've just got to man up and chin up and get on with it.
So if somebody's listening to you talking about this now, and they may have a concern, they may know they've got some kind of issue, but they're just frightened to talk about it, because if you're feeling a bit low, then you lose confidence, and so you just sort of stay in yourself, don't you? As you well know. What do they do? How do they come out of that?
I think it can be very scary to talk about mental health. I can acknowledge that. There can be the fear of, how is the other person going to react? And people react differently. Some people can react negatively to mental health because there can be a fear of the unknown. There can be a fear of, well, how is that other person going to be now that I know they have this or that or whatever? But that's their issue. That's not your issue. It's important for you to talk about these things, actually open up to it and accept that's who you are, because then you'll not be so trapped within your own head with all of these negative connotations, because you're opening yourself up.
How difficult was it for you to come in and do this today?
Oh, you can probably hear my voice is shaking a little. Yeah, difficult. Yeah. Nervous. I was nervous about coming in to talk about it, but I'd say I've got a level of confidence. So
you've done very well.
Yeah.
You've done very well. I think fantastic. Thank you for coming in.
That's all right.
I think if I can just chip in there as well, Mark mentioned about his wife and being able to talk to the wife, that support structure as well, and the carers, family members who can help if the conversation be had, and in a work environment, knowing, as you say, Mark is nervous today, but he's been very kind to come on. But understanding the people you work with, the triggers at times, some of the difficulties they're doing, and trying to structure a working environment that facilitates a person to be the very best person they can be, and not to generate an environment that is restrictive, that stops people, again, doing the valued work that Mark does and the colleagues at the centre.
One thing I was going to add, and this is a shout out to a lady who works at the hospital. Name's Bobby. She's a support worker, and she came up with a brilliant quote, which was, "It's not an end, it's just a bend," and that stuck with me for pretty much from that get-go, because when I had the breakdown, I did feel like it was an end. I thought everything had collapsed, but things have come from that. I now have a job. I got to volunteer. I got to change my whole direction.
Well, congratulations. Thank you so much for coming in. Really appreciate it on World Mental Health Day. I like that from Bobby. It's not an end, it's a bend. We'll remember that.